Here in the physical therapy clinic, we often get the question, what's the difference between tendonitis and bursitis? Tendonitis is an inflammation of a structure called a tendon. It's the structure that attaches a muscle to the bone. Bursitis is the inflammation of a bursa. A bursa is an anatomical structure that rests between the muscle tendon and the bone it attaches to, and its job is to reduce friction between the two. When either of those are inflamed, they both have similar symptoms of tightness around joints. It feels like muscle tightness, but it's usually tightness from swelling. This can develop into a dull ache that can start radiating around the joint, and that can even progress into more of a sharp pain with any kind of joint movement. Both tendonitis and bursitis are often brought on by the same types of pathologies. We often see bursitis and tendonitis come on with the onset of osteoarthritis, which is the breakdown of bones around the joint. People who participate in repetitive movements, like swimmers and golfers. We see it with overuse type of activities, like hammering at work or lifting boxes at work. You also see it with tight muscles around a joint, just people who are generally inflexible or might be inflexible because of an old muscle strain or injury. You see bursitis and tendonitis with generalized weakness, full body or just around a specific joint. You can even see that post-operatively, after surgeries, our muscles tend to weaken, and then we go right back into old activities. So that can contribute to some inflammation of tendons and bursa. You also see it with poor joint alignment, poor body mechanics, and poor posture with injury, like if you had a fall and you damaged a muscle tendon or even the muscle belly, it causes stress to the muscle tendon. And if you have a fall and land on your hip or your shoulder, you can actually damage part of the bursa that would contribute to inflammation. So a good way to figure out what's causing your pain is to come into our physical therapy clinic and have a physical therapist diagnose what's going on. And if it is a bursitis or tendonitis, the main goal is to get to this joint moving and gliding nicely to remove that mechanical problem of pinching causing inflammation. What we would do, we would tease out where the muscle imbalances are and address those, if any. We would use our hands to work on joint mobility and soft tissue immobility that could be limiting the mechanics of the joint. We would also look at your body mechanics and talk to you about what kind of functional activities you like to participate in, or your work duties, anything that would involve repetitive movements, swimming, golfing, painting. Overhead painters often have problems with bursitis and tendonitis. And we would really just address how your body's moving and making those joints healthy. So if you feel like you're having any of the symptoms of tendonitis or bursitis, click the link below or give us a call here at Loudon Sports Therapy Center, and we'll have a physical therapist check out your symptoms.